Inflation? What? And that's it. Hey YouTube land world! Today's video is going to be about a fairly new medication called Entyvio, also known as something that starts with a V and ends with a MAB. I will have it right here on the screen for you because I cannot say it. I have been on this medication since December 24th and I have had 3 infusions so far. In this video I'm going to explain what Entyvio does, how it works, and my personal experience on this medication. I received much of this information from Entyvio's website, which you can go to at www.entyvio.com. So just entyvio.com, and that's where you can find tons more information that I will be even providing you, but here's basically a summary of it all. Also, before I start this video, I am not getting paid to do this video. In no way am I getting compensation from the company or any sort of company. These are my own experiences, my own opinions, and the own information that I have gathered from my own research. Here we go! What is Entyvio? Entyvio is a new biologic treatment for adult patients, sorry kids, of ulcerative colitis and Crohn's disease. Entyvio is known as an anti-adhesion medicine. Now what does that mean? And this is paraphrased from the website, so I'm going to read it from my page. We have white blood cells in our bloodstream, and they are programmed to go to different tissues in our body. And this is your natural immune response. So some of your white blood cells are directed towards your GI tract. It's an abundance of these cells, too many of these cells, more like going into your GI tract. This causes your inflation? What? Or inflammation and your related symptoms. What Entyvio does is it blocks the amount of white blood cells that are entering your GI tract, which control the symptoms of inflammation, etc. So how do you receive this medication? You receive this medication through an IV infusion that lasts about 30 minutes long each time. You'll receive the first one at a slightly slower pace. My first one was about 45 minutes, and the next 2 I had were 30 minutes each. So it's super fast versus other IV infusions like Remicade, where it's about 3 hours long. So here's how it works. You have to get your first infusion, and that happens, okay? Then 2 weeks later, you get your second infusion. And then 6 weeks later, after that, it is every 8 weeks. At least for me, that's the routine. Pretty easy, right? Yeah, okay. So what's the goal of Entyvio? And this is right from the website, so I'm just gonna read it off. So it relieves symptoms caused by flare-ups, yay. It achieves early and long-lasting remission, also yay. It improves the appearance of the intestinal lining that has been damaged by your disease, awesome. And it reduces and eliminates the use and need of steroids, which is so wonderful and is awesome. So here's some statistics. This is specific to patients that have UC, but there's also statistics on the website about people who have Crohn's. But since I have UC, I'm going to read you off some facts about UC patients who have been taking Entyvio. 47% achieved a response within 6 weeks. 42% maintained a clinical remission within 1 year. 41% had an improvement in the way their intestinal lining looked to their health provider within 6 weeks. And that's it. But really, there's more on the website. You should really check it out. So according to the website, Entyvio does have some side effects. Ones that are listed on the website are pretty minor, although I'm sure there's some more heavier ones that are very rare. But here's the most common side effects, and I'm going to read them off the website right now. Common cold, headache, joint pain, nausea, fever, infections of the nose and throat, tiredness, bronchitis, flu, back pain, rash, itching, sinus infection, throat pain, and pain in general. So those are all the things that can happen. But now my turn. I'm going to explain to you my personal experience with the medicine. So far I have 0, and need I repeat that, 0 side effects with Entyvio so far. That's right, folks, 0. Now keep in mind that I have been on steroids, pills, self-injections, IV infusions, you know, the usual. So there's that. They have all had side effects that have ruined some good days, unfortunately. But Entyvio, now that I'm on this medication, I can confidently say that I feel great. I was on Humira for about 1.5 years before it kind of stopped working for me, so we decided to try Entyvio because there's not a lot of crazy options out there that aren't similar to stuff that I've tried before. Upon switching, because my doctor didn't want me to be on Humira and Entyvio at the same time, so upon switching, when I had my first 2 infusions, it really didn't do anything different than the Humira was doing when it wasn't working, so that really wasn't that great. But then upon the 6-week later infusion, man, did I see results. Right now, I'm pretty much symptom-free, except for some abdominal pain that I'm practically used to. So there's that, which is really awesome and really exciting. Not a lot of things have worked. So if you are like me and you're having trouble with all the other medicines out there, you should definitely consider Entyvio. Make sure to give it to at least the 3rd or 4th infusion before you start giving up on it, okay? Because unlike Remicade, it's more slow acting, so it's gonna take a little while to kick in. But then once you do that, hopefully you'll be fine. My fingers crossed for you. So other than my daily vitamins and my daily probiotic, the only thing I'm taking for my colitis is Entyvio, and it's awesome. 30-minute infusion every 8 weeks from now on. What could be better? I mean, there could be things that could be better. But in this case, what could be better? Thank you, science, and thank you, doctors. That's all for now. Leave any questions down below in the comments or message me on Facebook, which will be linked below. Like I've been saying before, I rarely check the private messages on my YouTube channel. Please comment below or message me on Facebook and I'll get back to you promptly. I hope you're all doing lovely, and I'll talk to you in the next video. Bye!